met Dr. Drehsen through a girlfriend who has had some work done through him, and she highly recommended him. And I guess I came to see him, it has to be a good 2 months ago, and I had the very good, nice tight jawline, nice tight cheekbones, and Monday I'm going in for the stem cell fat injections. I wanted something that would be long-lasting, and I was going for the fat, and then I found out about the stem cell fat, and not just because it's new, reading about it, researching it, I felt that for the value would be the longest term results, and I understand there's only one other doctor who does it.
Stacie had a number of surgeries she should explain. And I mean, how long ago has it been since we did the lift?
It's been about 2 months.
2 months, okay.
It was October 22nd.
Yeah. So basically I did a lift 2 months ago because she has a jawline was a little, not as nice as it used to be and so on. But I found it would be greatly interesting for her to get a stem cell injection, and especially the fat injection. The main idea is to soften up the feature, give a little bit more volume to the lip, soften up the brow. And she was kind enough to bring me a picture of her a few years ago. Now, if you look at the picture of her before, there's that, that's fullness a little bit everywhere in the cheek, along the jawline, in the lips, in the brow. If we look at a picture a few years ago, you can see that obviously she has a very nice and tight jawline. But there's a little thing different about the face, is that the face looks extremely youthful for a couple of reasons. Why? Number one, because there's that fullness in the cheek. There's also a little fullness in the brow, more fullness in the lip, and that's what you're trying to do by boosting the fat injection with stem cells to restore, number one, the quality of the skin, and number two, maintain the fat that has been injected there, and give that much more pulpous, youthful look. But what I'm trying to do is give a bit more volume. I want to smile a little bit. See when she smiles, you bring immediately that volume in the cheek, give you a much more youthful look. And I'm going to put the fat injection, the stem cell all along, including the brow, and including the jawline here, to give a bit of a strong jawline, and the lips. She has a bit of makeup right now, but I mean, we can look at the pre-op picture. You can see the skin has been substantially damaged. Looks better now, but still it's been substantially damaged. What we hope to see is that with the effect of stem cell mixed with the fat micrografting, you're going to see also an improvement of skin quality beyond the restoration of volume. The procedure we're going to do Monday basically will be like a form of a mini liposuction. We have to take a certain amount of fat. We're going to process the fat, so the fat that we take in the first batch of fat taken from the abdominal area will be processed so we can obtain pure stem cell out of this. The stem cell will then be re-injected with a little additional batch of fat that will be then injected. What I try to do then is to highlight the cheekbone, strengthen the jawline, improve the lips, put some fat along the brow to give that more pulpous look to it. So the procedure itself is really layering fat cell or fat micrografting through the entire face, including some of the neck. As the public become more and more aware, the microfat grafting or fat injection to the face or other area of the body has produced surprising results. Some of them has been, number one, improving the volume, improving the freshness of the face. What we're expecting from the stem cells, since they've proven to be helping in maintaining the graft better than without the stem cell boost, is to maintain what we're going to do without doing a major overcorrection. If you put the stem cell mixed with the fat, it's been proven maybe you increase the fat take at about 80% instead of maybe 50% without adding stem cell. The processing of the stem cell is done to an equipment called Solution, or this company called Satori, originally from California. They've developed most of the equipment in Europe, and so there's been a number of experimental studies made with that procedure in Europe. They were based mostly in trying to improve breast volume or restore breast asymmetry or reconstruct breast with fat injection in the breast. What I'm doing right now, which is probably I'm among the first one in the state to do, is to use the stem cell in the facial area and judge the quality of skin improvement with it. Well, stem cell will be essentially a procedure of the future. Stem cell extraction are used now in a multitude of other disciplines beyond cosmetic surgery. They use in bone restoration, they use in gum restoration, they use in nerve restoration, and they even use it directly as injection into damaged heart. The fat extraction itself is a simple mini liposuction type of procedure. With a syringe, we take the fat out of an area where there's a little bit too much fat, especially the lower abdominal area where there's a lot of stem cell. So once that fat is extracted, it's then processed with that equipment that I have acquired, and we obtain then some pure stem cell. This pure stem cell can then be frozen for an indefinite period of time and be re-injected as needed for the people who are candidate for it at any time in the future. Stem cell have also been used in after surgery for different type of accident where people have sustained serious scar, and I've personally seen after injection of fat under a scar a substantial improvement of the scar quality, and I expect that boosting that fat injection with more stem cells should only improve the result.